Good afternoon, everyone. Welcome into our COVID-19 media update for September 8th. We have a handful of people here on our call with us this afternoon. Thank you for joining us. And we're going to get started with Dr. Rachel Herlihy, the state epidemiologist at CDPHE. And then we will have Heather Roth as well, the immunization branch chief, the Division of Disease Control and Public Health Response at CDPHE. So let's go ahead and send it over to Dr. Herlihy. And Dr. Herlihy, you can get us started for today.
Great. Thank you so much. Good afternoon to all of you, and thanks for being here. So I want to start here where we normally do with an update on our case trends. So this figure shows you our 7-day moving average number of cases in red, and then each of those gray vertical bars shows you our daily case count. You'll notice that we've labeled some of the data points in this figure today. So showing you data from yesterday, we had a 7-day average of 1,593 cases. And that's compared to June 21st, when we really saw our low number of cases this summer, and that was 303 cases. So as you can see, we've really seen a steady increase in cases here in Colorado. We are seeing what I would describe as, this linear or steady increase. We haven't seen what some states across the country have seen, particularly in the Southeast, where these exponential increases have occurred. But unfortunately, we do continue to see this linear increase. If you look closely at the far right side of this figure, you will see that 7-day average does dip down a little bit. It's difficult to know right now if that is a true decreasing trend at this point, or if that's really just a holiday weekend lag that we are seeing in some of our data. So stay tuned and continue to look at our data, I'd say, as the week progresses to see if that trend changes in the next couple of days. Next slide, please. So that decrease that I mentioned in the last couple of days becomes even more apparent as we zoom into the data a little bit. And this figure is showing you some of our age-specific trends. I've shared this data with you recently. So here we look at trends in specific pediatric age groups compared to our 18+ population, which is shown in red here. And obviously this wave of the pandemic is unique, both here in Colorado and across the country, and that we are seeing more of an impact of COVID-19 on our pediatric population or school-aged population. So right now you'll see that our highest rate of transmission, and it's been that way for the last couple of weeks, is really occurring among that 6 to 11-year-old population. So those are our school kids that are really too young to be vaccinated, and then followed by that 12 to 17-year-old population, again, school-aged kids. Next is the adult population, and then our lowest rate continues to be in that 0 to 5-year age group. Next slide, please. We do continue to see a steady increase in hospitalizations. So as of today, we have 891 individuals in Colorado that are currently in the hospital. That is the highest number that we have seen since January. So that number corresponds to the numbers of hospitalizations that we were seeing in early November as we were rapidly seeing an increase in our fall wave of illness, or again corresponds to counts that we saw in January as we were really coming down from that large wave of illness that we experienced. So certainly concerning trends that we continue to see as hospitalizations continue to increase in the state. And I'll talk a little bit more, and when we get into the dashboard data about our vaccine breakthrough data, which is a lot of what I want to share with you today. But we, of course, continue to see that most of the transmission, most of the hospitalization is really occurring among our unvaccinated population. And that's certainly true in this data, the hospitalization data that you're looking at now. Next slide, please. All right, so moving on to our vaccine breakthrough dashboard. So this is the dashboard that is actually live on our website now. I'm excited to present this to you. I know that there's been a lot of interest in this data from many of you. And our goal here today is, one, to make sure that you have access to this data as you need it. So you have the access to the same data that we are really seeing day to day, and are able to look at trends in vaccine breakthrough cases as they are occurring in the state. And part of the reason that we wanted to share this data with you today through this briefing is to also give you the opportunity to sort of see how I'm interpreting and thinking about this data, to really help you interpret and think about this data, and for our media folks to really figure out how to message this data and explain this data to members of the public. So starting here, this is data that's shown on the homepage of that vaccine breakthrough dashboard. What you can see here are these fast facts, these boxes here that show you rate-specific data. So this is going to be the number of vaccinated cases divided by the total vaccinated population in that first box. And then the second box is going to show you the unvaccinated cases divided by the unvaccinated population. And then that continues with data that's similar for hospitalizations and then deaths as well. You'll also see that in each of these boxes, you'll see that the overall median age of each of those groups is shown. And you'll see that there are some important differences. In general, we are seeing that our vaccine breakthrough cases do tend to be older individuals. And that same trend holds true for vaccine breakthrough hospitalizations and vaccine breakthrough deaths. There's probably several reasons for that. One is just that our vaccinated population tends to skew a little bit older. We know that our highest vaccination rates are among our older age groups, and that's some of the data that Heather's going to share with you in just a little bit. But also we know that our older population is the population that is probably most susceptible to waning immunity. They may have not had the most robust immune response to the vaccine to begin with. And so we know that those are the individuals that are potentially at higher risk of becoming vaccine breakthrough cases. And again, that really reinforces the messaging that we have out there right now about the importance of wearing masks, especially if you have regular contact with individuals who are higher risk, or if you are someone who yourself is higher risk and higher risk potentially of becoming one of these vaccine breakthrough cases. Next slide. So this next graphic is on our homepage of that vaccine breakthrough dashboard and shows you rate ratios, or basically the level of increased risk that is associated with becoming a case, being hospitalized, or dying from COVID-19 if you are an unvaccinated individual. So each of these numbers here, 3.4, 3.7, and 5.8, correspond to the increased level of risk associated with being unvaccinated compared to vaccinated. And so these data are really the ratio of those rates that I showed you in each of those boxes in the last slide. So for example, if you look at that 5.8 value, the risk associated with dying of COVID-19 if you are unvaccinated compared to vaccinated is the ratio of the rate of cases the case rate that we're seeing, the death rate that we're seeing for COVID-19 breakthrough in unvaccinated individuals, which was 46.9, divided by that rate in vaccinated individuals, which was 8.1. And that ratio is 5.8. And so the way that you translate that is to say that individuals that are unvaccinated are 5.8 times more likely to die of COVID-19 than those that are vaccinated. Next slide, please. And so moving on to some of the visualizations that are available on this website, what you can see here is a number of graphics, a number of graphics or visualizations that you can click on to look at different types of data. And so I'm starting here with this state level data. So you'll see that state level box is highlighted in red. It means I've clicked on that state level indicator. And what we're looking at here is data for all vaccines, and we're looking at case-specific data specifically. And here you can see both the rate differences and the count differences between risk of becoming a COVID-19 case for unvaccinated versus vaccinated individuals. As always, on our website, when you hover on these graphics, what you'll see is more detailed information. And that's what's shown in the white rectangular box in the right-hand bottom corner. You can see for the week of 8/22, 2021, you'll see that those rate differences are shown there. You'll also see that we have the case counts and the total denominator or population of unvaccinated people versus vaccinated people that we're showing you here. As we get more into these graphics, though, I want to explain some of the limitations of this data and how this data is going to appear and what you can expect as you look at this data. So the first thing to know is that these data are going to be updated on every day of the week, so Monday through Friday, weekdays. But what you're going to notice is that these are weekly data, and what will appear each Monday is the next week worth of data. For this particular figure, which is showing you case data, the case data is going to be lagged by 1 week, and that is really to make sure that we are presenting you with the clearest, best data that we have, and really allowing you to make sure that you can rely on this data, that it's really the best data that we have, it's complete data, and really the most robust that we have to offer you. And then if you go to the next slide, when we look at our hospitalization data, that data is going to be lagged by 2 weeks. And again, lagged by 2 weeks to make sure that data is complete and reliable data for you to interpret. Similar to that last slide I showed you, this is showing you the overall ratio of unvaccinated versus vaccinated cases, hospitalizations that are occurring. And also when you hover on that last data point here, you can see the number of unvaccinated hospitalizations, the total number of unvaccinated people as that denominator, and then the same values for the vaccinated population. Next slide. Moving on to our death data, you can expect that this data will be lagged 3 weeks, again, to ensure completeness of the data and the highest quality data. But what you see here is very similar to the last figures. What you can expect, though, is that this data is going to be shown on a monthly basis. And that's really because of small number issues. We want the data to be stable and reliable. And so because of that, we are grouping this data, the death data, as monthly values instead of weekly values. So here you can see for the month of July, you can see again that ratio of rates. So the rate occurring in the unvaccinated population compared to the vaccinated population, and those same raw numbers, the number of unvaccinated deaths and the number of unvaccinated people. And again, the number of vaccinated deaths that have occurred and the number of vaccinated people. Next slide. We also, if you choose to look at the vaccine-specific analysis, so that upper right-hand box at the top of the graphic here, you can choose to look at individual specific vaccines. So the Pfizer vaccine, the Moderna vaccine, the Janssen vaccine, or in this particular figure, we're looking at all vaccines combined. And what you can do here is compare the rate of cases that we are seeing among the unvaccinated, which is shown in gray, and you can compare that to the rates of vaccine breakthrough cases that we're seeing with each of these different vaccines, the Janssen vaccine, the Moderna vaccine, and the Pfizer vaccine. I do want to caution you that this is raw data. This is not data that has been controlled for age or time since vaccination. So it is possible that there are other reasons that could be contributing to the observations that we see here and the differences that we are observing in vaccine effectiveness, which might not just be due just to the overall vaccine effectiveness. It could be that we're seeing differences in age groups who may have received one vaccine versus another. But again, we want you to have access to the same data that we have access to and that we are looking at. Next slide, please. Finally, we have demographic data. So you'll see that I've now hovered over to the demographic label here shown in red. And here you can look at data by age group, by race, ethnicity, or by gender. And this data is presented very similar to how we present other data on our website. So what you can do in this particular figure is look at the overall distribution of the vaccinated population here in Colorado. And that's shown with each of those gray bars. And then with the colorful bars, you can look at that same distribution, but for vaccine breakthrough cases. So as an example, if you look at that 80+ population where I have the box shown there, you can see that 4.4% of Colorado's population is 80+ of vaccinated population is 80+. And that's in comparison to 5.9% of our vaccine breakthrough cases occurring among that 80+ population. And what looking at the data in this way allows you to do is to look at specific age groups where we might see overrepresentation or underrepresentation among our vaccine breakthrough cases. And so specifically here, because that blue bar is exceeding that gray bar for the 80+ population, you can see that our 80+ population appears to be at higher risk of becoming vaccine breakthrough cases compared to some of those younger populations. Next slide, please. And with that, I'll hand it to Heather.
Thank you, Dr. Hurley. So today I'm going to give you a brief vaccination update in terms of where we are as a state. I'll dig a little deeper into pediatric vaccine coverage as well. So this slide just shows you, again, this can be pulled from our public dashboard, our weekly COVID-19 vaccine administration numbers. You see that huge peak in April, but we have given more than 7 million total doses in our state, and 74.7% of eligible Coloradans 12 years and older have received at least one dose of vaccine. And the thing I want to draw your attention to is this nice steady increase since early July. And just a reminder that this data is a little bit lagging as well. So I anticipate that steady increase to continue as we move forward. Next slide, please. So how are we in terms of coverage among age groups? This slide shows the percent of the Colorado population with at least one dose by age group. So you can see our 12 through 17-year-olds are sitting at 56.3%. We're at 65.9% for those 18 through 39, 74.6% for those 40 through 64, and then 89.2% for those adults 65 and older. And again, this includes data that has been reported to the Colorado Immunization Information System, and it also includes data reported by federal entities. Next slide. So this slide shows a map that was included in a recent CDC MMWR publication that really described COVID vaccine coverage, both fully vaccinated coverage rates and one dose coverage rates by state and jurisdiction nationally. And so the map that you see here shows the percent of adolescents 12 through 17 who have completed the COVID-19 vaccination series. Again, this is a little bit dated. This included data through July. The darker the shade, the higher the rate. And so you can see visually that Colorado is doing pretty well when you compare it nationally. We have made progress since this report came out as well. So we pulled data from CIS, and we have 56.3% of our adolescent population, our 12 through 17-year-olds who have received at least one dose of COVID vaccine. So really proud about our progress. But you can see that that rate for that particular age group varies pretty significantly among regions across the state. And so we're continuing to devote our resources to increasing access and making it convenient and really getting these adolescents in for the COVID-19 vaccine. And I think that's all I have for the brief update today.
All right, thank you, Dr. Herlihy and Heather. We are going to move into our media Q&A portion of today's Avail. And just a little couple of housekeeping notes. We'll use the raise hand function if you'd like to ask a question, and I'll go ahead and call on you in the order that those requests were received. If you have a question about a topic that was not covered on today's Media Avail, please send us an email at media_info@state.co.us, and we can address that with the appropriate subject matter expert. And let's go ahead and stick with first questions first. And if we have time, we will get through some follow-up questions. Please do ensure that you don't have any auto playing tabs, or if they are playing, they're muted. And before you ask your question, if you could please state your name and your outlet, we would appreciate that. We can get things started with Meg.
Hello, this is Meg Wingeter from the Denver Post. I wanted to clarify, it showed on the dashboard, those rates as of July. And is there any indication of whether it was pretty much the same in August in terms of comparative risk, or whether that has Delta continued taking over?
Yeah, this is Rachel. I can take that question. So I think your question is whether the risk of vaccine breakthrough disease has increased as the Delta variant has emerged. And I think the short answer to that question is yes, to some degree. We have seen a decrease in vaccine effectiveness. It's not been a substantial decrease in vaccine effectiveness, but we have seen a decrease in vaccine effectiveness. That's primarily associated with the risk of becoming a case. We do continue to see really highly effective levels of protection with the vaccine against becoming hospitalized or against death, particularly. So I think there are some differences in the level of vaccine effectiveness depending on which measure you're looking at, which outcome you are looking at. But in general, we have seen some of those changes as the Delta variant has emerged, unfortunately.
Before we get to the next question, I do want to note that we also have our state lab director, Dr. Emily Travanti, with us available for media Q&A. Forgot to mention that before we got started. Let's go ahead and go to John Daly.
Hi there, can you hear me okay? Hello?
Yes.
Hear me?
Yes.
Okay, all right, great, thank you. So on the vaccinations, I was wondering if there's a story out of Jeffco with some of the vaccine folks, public health folks who are giving vaccines, that they had some issues getting harassed over the weekend and they had to pull back on their efforts. Have you heard of that happening in any other locations? And what do you think of that? And And are you concerned about that impacting the overall vaccine effort?
Yeah, I can take that. Thanks, John. We were aware of the issue in Jeffco, and I think there have been a handful of other isolated incidents as well. I do want you to know we work with CDPS and DHSCM to monitor and respond to any of these types of threats. And the other thing, we want to remind all Coloradans to contact their local law enforcement agency if they are aware of a specific threat associated with a COVID-19 vaccine clinic, regardless of who's putting it on, and to report any suspicious activity to the Colorado Department of Homeland Security and Emergency Management. So if you see something, say something.
Right, Anusha.
This is Anusha with 9 News. There's been an ask to get this kind of vaccine breakthrough cases data separated out for people to look through for quite some time. So why did it take this long into the vaccine rollout to be able to actually get this dashboard up and running for people?
Yeah, so the first thing I want to say is that we have been regularly sharing this data during press conferences. Certainly, there have been many media requests for this data. I think what we really wanted to make sure we did in developing this dashboard is make it readily consumable by the general public. It can be complex and confusing data. And so it did take quite a bit of work to pull the data together in a way that really allowed individuals to look at the risk of becoming a vaccine breakthrough case compared to the risk of being an individual who's unvaccinated. And so we wanted to get that right. We wanted to get the messaging right. We wanted to get the graphics right. We've been taking feedback from multiple sources on how to best present this data. And so hopefully that's what we've delivered today.
Chris Vanderveen.
Chris Vanderveen with 9 News. Question probably for Dr. Herlihy, but anyone can feel free to take it. Under the governor's order, you're requiring hospitals to daily update you on vaccination cases. And yet this information sharing that you unveiled today is delayed by 2 weeks. I'm trying to understand why that is. If you're getting real-time data from hospitals on breakthrough cases on a daily basis, as is the case with the governor's order, I don't understand why it's taking you 2 weeks. Because, I mean, in essence, we think that hospitalizations are sort of the proverbial canary in the coal mine, and yet right now we're having to wait 2, if not as many as 3 weeks to understand if that canary is in trouble. I guess I'm just trying to understand why the delay in that data release.
Sure, that's a great question. So thank you for asking that question. I think that's a question that we want to clarify. And so we have multiple sources of data. And that source of data that you are talking about is data that comes to us through the EM resource system. It's a hospital reporting system. What the hospitals are reporting to us through that system is aggregate data. It's not the highest quality patient level data that we get through our state surveillance system. It's a system that we use called CDERS. That data that we are getting through our CDERS system is line level list data, meaning that for every patient that test positive for COVID-19. We collect a variety of data, oftentimes through patient interview. We also collect data from their hospital stay. And for individuals that die, we get that data from their medical record. And so that is much more complete, robust data. What we're also using to complete that data source is we're matching that data to the immunization registry. And so again, we're getting the best data we have about whether an individual was vaccinated or not, what the dates of those vaccinations were, whether they were partially vaccinated. And so all of that highest quality data is really what we're pulling into this dashboard, really to make that data stable and robust. We really want it to be the highest quality data I think it's important to recognize too that vaccine effectiveness doesn't change overnight. And so we don't expect our vaccine breakthrough rates to change overnight. Even with the emergence of the Delta variant, it really took a while for Delta to emerge and become the dominant strain and to see that impact on our vaccine effectiveness data here in Colorado. And so we don't expect this to be something that you need to be looking at on a daily basis necessarily. We certainly want to have that situational awareness, and that's what we're using the EM resource data for, is that snapshot, that less precise look at the data. But ultimately, we really want both. We want that immediate situational awareness with the best data we can get as quickly as we can, and then this more robust data that is really what we feel the highest quality information we can gather. It just takes a little bit more time to gather that high quality information.
John Frank.
Hey, John Frank here from Axios. Going back to the chart you showed about the differences of breakthrough cases when it came to age, I can't help but notice the huge overrepresentation from ages 20 through 49. I know you focused on ages 80 plus, but what do you think is happening here with these, I guess you could say, younger folks, and why they are a larger proportion of the breakthrough cases than their population would suggest? Thank you.
Yeah, that's a great question as well, and something we've obviously noticed in the data too, and something that we are trying to explore further. We have a couple of hypotheses. One is that your risk of becoming a vaccine breakthrough case is dependent on exposure. And so the more exposure you have, the increased likelihood it is that you are going to become a vaccine breakthrough case. We know that throughout the pandemic, we've really seen the highest rates of disease transmission in our 20 to 30 something population, even our 40 something population. That tends to be the population that is out and about, working in the service industry or other places where they're really in contact with a large number of people. So that could certainly be part of the story. That's just the population that is at greatest risk of being exposed to other individuals. The other possibility is some of those, what I mentioned, confounders, or some of those other factors that we haven't necessarily been able to control for in this data. And one of those could be vaccine type. So it's possible that different vaccines were used for different age groups. We know that the first vaccines that rolled out were the mRNA vaccines. Those vaccines tended to be used first in our older population. And then as the vaccine rollout proceeded, we had increased access to the Janssen or Johnson & Johnson vaccine. So it could be that that vaccine is skewed towards a younger population, was used more commonly in a younger population. We've known since the beginning, since that vaccine was authorized, that it does have lower levels of effectiveness than the mRNA-based vaccines. So again, that could be one reason. It could be that that vaccine is more common in the younger population. But again, those are just questions that we're exploring right now. We have those same questions you have.
Right. Not sure who it is, but whoever is here representing Univision.
Hello, my name is Jesus Carrasquel. I'm news producer for Univision Colorado. I just want to know the update for the new variant of the COVID-19.
Yes, I can take that question. I believe your question was about the Mu variant. So that is a new WHO identified variant under investigation that was first identified in Colombia. In Colorado, we've had 83 identifications of that new variant since April. So it continues to be really a very small percentage, a fraction of a percentage of the cases that we are seeing in the state right now. In fact, nearly 100% of what we're seeing in the state right now is the Delta variant. So we really haven't seen the Mu variant take off in the state at this point.
All right, Meg.
Hello. I wanted to clarify, when you have the vaccinated versus unvaccinated data, where do people who are like partially vaccinated fall into this? If somebody, got one shot and then they tested positive before getting their second one?
Yes, great question. And as always, you can go to the I button, that info button on our dashboard to try and learn a little bit more about some of the data. But the way that we evaluate, in the way that we've been doing this for several weeks now and looking at vaccinated versus unvaccinated, is that those partially vaccinated individuals are grouped in with the unvaccinated individuals, meaning that vaccinated folks are people who are fully vaccinated at least 14 days out from their last dose of vaccine, if it was a 2-dose series, or from 1 dose if it was the Janssen or Johnson & Johnson vaccine.
Thank you.
Nusha.
Now that the dashboard is available to the general public, how are you anticipating or would want them to interpret this data when it comes to just how they're living their day-to-day lives and their COVID precautions?
Yeah, great question. I think the most important thing that this data can provide to members of the general public is clear information about the different level of risk of becoming a COVID-19 case, of being hospitalized or dying of COVID-19 if you are unvaccinated versus vaccinated right now. We know that unvaccinated individuals are really driving transmission in the state and actually across the country right now. We know that the risk is really much higher for individuals that continue to be unvaccinated at this point.
And let's go back to John Daly.
I just taking this a little bit more broadly, what metrics will you be following most closely to get an understanding of what's happening in schools this fall, and I guess also what should the public be looking for regarding that?
Yes, so as I presented, we are seeing right now the highest rates of transmission are occurring among school-aged children. I want to be clear, though, that risk to kids right now is certainly going to be in school settings, but it's also outside of school settings. And it's important for parents to recognize that their kids are at risk, not just through potentially going to school or exposures that could happen at school, but also in many other settings. And I've said previously that with how widespread transmission is in the state right now, it is a pretty risky time to bring unvaccinated children to large gatherings. We need to keep in mind that all of those things that we were doing last year continue to be important now for our kids, actually probably more important than ever, to protect our kids from COVID-19 transmission. The data sources that we're really going to be looking at are the same data sources we've been following throughout the pandemic. It's rates of cases occurring in kids, it's hospitalization trends among children. Certainly, we know that deaths can occur among children as well, so we'll be watching that data. We also look at our percent positivity data. We look at school outbreak data. Those are all things that we're tracking very closely at this time.
All right, thank you. It looks like that will bring today's COVID-19 update to an end. Reminder, if you have questions about topics that were not covered today or follow-ups from this presentation, please feel free to email us at media_info@state.co.us, and we'll get back to you as soon as we can. Thank you, Dr. Herlihy, Heather Roth, and Dr. Travanti for being here with us today, and we hope y'all have a good rest of your afternoon.